me ask you this, because that just brought my mind up another question, and you've been successful at this, I think, and I'd love to know what your mind goes to. How do you go about advocating for more BHCs? Because this is something we hear regularly, and it's like the biggest irony about like integrated care is that everybody's almost like a believer, oh, a BHC could see any patient, but no one has the people power to be able to do that. How do you go about suggesting to organizations, to other directors, to BHCs to advocate like, hey, we need another BHC?
I can only speak to what I found to be successful, and I definitely think that it can be, it can be done at other sites as well and other organizations. One thing that has been so successful is you're going to want to see a lot of patients and get to a point where the medical providers are the ones who are advocating for you.
Interesting.
So what we'll commonly hear is, well, I can't get to more warm handoffs because there's only one of me, right? And because I can't get to warm handoffs, nobody utilizes me. So that when you go and you look at the numbers, there's a really low utilization. So then, of course, when you bring that to admin, they look at the numbers and they say, well, you're seeing 4 patients a day. How could you possibly need another one?
How can you not be getting those other handoffs?
Yeah, how could you not be getting those other handoffs? So part of me, who's worked in a BHC role, I get it. I get how difficult it can be when you are working solo in a clinic, how after a few times, if you get handoffs coming in at the same time, that you're only going to be able to take one of them, I could see how that can erode the relationship and people aren't going to utilize you as much. But you're better off doing everything that you can to get your numbers up. Because if you have the equation of high productivity plus medical provider complaints, that's what's going to get you a requisition approved. If you have low utilization plus medical provider and staff complaints, not quite sure what that equation is, but it's not going to be good for building your BHC team. So essentially, when you're new to integrated care, you're going to have to lace up and you're going to have to be ready to go. And that's what this is. I mean, that's what we're trying to do is, with integrated care, is be on the cutting edge, or as you always say, the bleeding edge. And so in the beginning, it's going to be tough. It's like any startup company. You're going to put in more hours that at that point are unsustainable long term. But if you're successful in a startup business, what will happen is at a certain point you become profitable, and then you can hire more staff. You're not going to continue at that pace. It's kind of a similar metaphor for BHCs. You kind of have to earn your keep and do everything that you can. And I know that this might not be like the most popular message out there, but it really, when you and I did it, and it didn't feel like Burnout City. It felt positive. Yeah. It felt like, I'm here. We're doing it.
I like that entrepreneurial kind of approach to it, right? Like if you're having a startup company, like those startup days, like aren't going to be these just rainbows and sunshines. They're going to be probably really stressful. But that is the point, though, is to put that time in and really ramp up, so you do have that ability then to go. And I think the other thing that you said that my mind really liked was like the importance of metrics. That there can't be almost this thing. It's like, oh wow, yeah, I'm seeing 10 patients a day and I'm still missing handoffs. So it's like objectively, like, are you seeing 10 patients a day? Because we all remember those days that it's like, oh, I saw 14 patients in that one day. And then we forget about the days that it's like, oh, I saw 3.
Oh, yeah.
Right? So I think that's when going to administration and having hard data to say that these are our metrics, these are how many patients that we're seeing a day, and these are maybe potentially how many handoffs we're missing, plus having those provider complaints. Not complaints, but these provider voices saying, we want more coverage.